Greetings and welcome. I am very excited to be here today with all of you. As we get settled and members join, please take a moment to introduce yourself in the chat. Write your name, your title, the organization you represent, and a word or two that describes your thoughts and feelings about the first day of school. We will get started at 10:03 a.m. Thank you. Welcome. My name is Carrie Sequeira, and I have the honor and privilege of working with an amazing team at the Office of School-Based Health Programs, the California Department of Education, under the Whole Child Division. I want to take a moment to thank our State Superintendent of Public Instruction, Tony Thurmond, who created this division to support the whole child. I have an amazing team that works with me every single day, and it is a pleasure to be with you here today. I want to go over our webinar objectives for the day so you know what we're focusing on during our time together. Number one is increase awareness, equip the participants with up-to-date information on newly chaptered legislation, statewide initiatives, and agency partnerships that impact students' well-being, including updates from California Department of Public Health, CYBHI, and the CDE office such as TUPE and the Office of School Health. Promote cross-sector collaboration, highlight opportunities for collaboration between schools, local agencies, and our statewide partners, such as SALUNA, Youth Mental Health First Aid, and California School Nurse Organization to strengthen comprehensive school health systems. Provide access to technical assistance and resources. Connect educators, school staff, and community stakeholders with practical tools, technical assistance, and vetted resources to support students' mental, behavioral, physical, and social emotional health throughout the school year. Support implementation of evidence-based programs, share best practices, guidance, and real-world examples from the field to support the implementation of programs and services that promote the whole child wellness with a focus on prevention, early intervention, and culturally responsive care. And foster readiness for the new school year, empower schools and district leaders with strategies to build safe, supportive, and health-promoting school environments that are responsive to the needs of the diverse student populations as they return to school. I have the honor of introducing right now the California School Nurse Organization, who is partners with the CDE to provide the best resources and support, and they are often responding to questions from the field to help within the school communities. Katie Nilsson has been a licensed registered nurse for 25 years and a credentialed school nurse since 2006. Katie serves the community of San Joaquin County and is currently the president-elect for the California School Nurse Organization. Katie, will you come join me up here?
Thank you so much for having me this morning. I am honored to be here with you all this morning to share key updates, resources, and priorities for school nurses as we head into this new school year. Next slide, please. The California School Nurses Organization is a professional home for school nurses, a place for support, advocacy, and professional development. One of the most exciting developments for us is our recent High Road Training Partnership Grant. Over the next 2 years, this will allow 150 school nurses to obtain their school nurses credential, strengthening our workforce and expanding access to qualified nurses in schools. We also develop and provide products like the Specialized Physical Healthcare Services Guidelines, covering best practices and requirements for procedures such as diabetes management, medication administration, and stock medication protocols. Beyond products and resources, we also offer professional development and networking opportunities at events such as our annual conference every February, section fall and spring conferences, and our monthly happy hour sessions with timely topics such as legislative updates and mass casualty incidents. Next slide, please. Back to school is one of our busiest times of the year, and school nurses have quite a to-do list. Right now, we're coordinating care for students with chronic conditions, updating individualized healthcare plans, reviewing and obtaining necessary medical orders, and managing immunization compliance. We're also training staff on such things as stock medications, epi, naloxone, and albuterol, and ensuring they're prepared to respond to each student's specific care plan needs. And of course, we're gearing up for mandated vision and hearing screenings, so students have the best opportunity to learn without avoidable barriers. Next slide. Education code requires LEAs to have a comprehensive suicide prevention plan. This policy must cover prevention, intervention, and postvention procedures and include training on suicide awareness and prevention for staff. It also requires that crisis and suicide prevention hotline numbers be printed on student ID cards and that schools inform parents and students at least twice a year about how to access available mental health services on campus or in the community. The CDE offers excellent resources through its Youth Suicide Prevention webpage, as well as Living Work Start provides training for a fee to help staff recognize when someone might be thinking about suicide. Next slide. Mental health support is also within the school nurse's scope of practice. And we often see students before they've received a mental or behavioral health diagnosis. Many come to us with somatic complaints, such as headaches, stomach aches, or fatigue that are often linked to challenges affecting their emotional well-being. Our assessments include talking with the student, observing behavior and affect, and sometimes using evidence-based screening tools. When we identify concerns, we connect the student to appropriate resources, whether that's a school-based mental health professional or working with them or their parent or guardian to find a provider in the community. Next slide, please. Ed Code also mandates review and verification of immunizations prior to school entry. We have several tools to help with this process. They include the school and child care roster lookup to verify student records, the Shots for School website for up-to-date requirements and reporting guidance, and CareMe for processing and managing valid medical exemptions. Timely and accurate compliance reporting helps keep our school communities healthy. Next slide. The CDPH guidelines for communicable disease and childhood illness is a powerful tool for guiding school staff, families, and students on when a child should remain at school or be sent home. Contrary to popular belief, the majority of students visiting the health office aren't being seen by the credentialed school nurse. They're being cared for by trained, compassionate, unlicensed staff like health technicians, office managers, or attendance clerks. These guidelines clearly outline the most common non-emergency conditions seen in school and help standardize responses. As a school nurse, I've used this tool with parents and students to explain, based on state guidance, that a student can remain at school. Using these guidelines can improve attendance by keeping healthy students in class and ensuring students who are contagious stay home. Next slide. While the CDPH guidelines provide the foundational standards, CSNO also has guidelines for communicable diseases and common conditions in the educational setting, and they go a little step further. This easy-to-use flip chart expands the list of conditions, adds interventions, and includes pictures to aid identification. Many schools purchase this tool to help staff respond confidently to common communicable conditions. It's practical, accessible, and a great complement to the state's guidance. Next slide, please. Vision and hearing screenings are state mandated at specific grade levels: kindergarten, 2nd, 5th, 8th, 10th, and upon first entry into school. Vision screenings are often conducted by the credentialed school nurse, but may also be done by an RN, LVN, or certificated employee, all under the credentialed school nurse's supervision. Hearing screenings must be conducted by a school audiometrist, and most credentialed school nurses hold their certification as part of their credential program. These screenings are essential because undetected vision or hearing issues can greatly impact a student's academic progress. School nurses play a critical role in connecting families with resources for glasses, hearing aids, or medical follow-up, and in collaborating with the school team to arrange academic accommodations as when needed. Next slide, please. Asthma is one of the most common chronic conditions in children and a leading cause of missed school days and hospitalizations. Albuterol inhalers are life-saving bronchodilators that relieve asthma symptoms and other respiratory distress. Currently, districts may choose to stock albuterol inhalers with administration by the school nurse or trained volunteer. Clear policies should outline who can administer, how it's stored, and when it's used. Training staff to recognize asthma symptoms and administer albuterol can be life-saving. The California Department of Education is currently revising the administration of albuterol inhalers training standards, which are posted on their website. The updated version is expected to be released soon. Thanks to strong advocacy at the state level, the California Department of Public Health, in collaboration with the CDE Office of School Health, will be providing statewide standing orders for stock albuterol inhalers for use in schools. These standing orders are anticipated to be available soon. Next slide, please. 10 years ago, Ed Code 49414 was revised to require that school stock epinephrine auto-injectors to treat individuals experiencing or reasonably believed to be experiencing anaphylaxis. The California Department of Public Health now provides standing orders to all LEAs, allowing districts to obtain free epinephrine devices through the EpiPens for Schools program. Training standards for the administration of epinephrine auto-injectors are available on the California Department of Education's website. We are also closely watching Senate Bill 568. This bill would change the law's language from epinephrine auto-injector to epinephrine delivery system. If passed and signed by the governor, California schools would become eligible for the Neffy in Schools program, which provides free stock nasal epinephrine. Next slide, please. Naloxone is an opioid antagonist that can quickly reverse an opioid overdose, potentially saving a life within minutes. Schools can obtain free naloxone and standing orders from the the California Department of Healthcare Services. Ed Code gives school districts the discretion to decide whether to stock emergency naloxone and have trained personnel available. In making this decision, districts must evaluate local emergency response times and determine whether relying solely on 911 is an acceptable alternative. As a strong advocate for student health and prevention, I encourage every district to consider stocking naloxone. The application process is straightforward. The training is manageable, and having it on hand can make the difference in a life or death situation. Next slide, please. The CDPH has created a survey to gather data on stock medication use in schools. This information will help CDPH understand how often these medications are used and how effective the program is statewide. The more responsive we have, the better our data will be. So please take a few minutes to complete the survey, which can be found on the CS&O website. Your participation will directly support our advocacy and program improvement efforts. Next slide, please. Under Education Code, new employees and volunteers who have frequent or prolonged contact with students are required to complete a TB risk assessment every 4 years. Only licensed healthcare providers can conduct this assessment. This includes credentialed school nurses, RNs, and LVNs. The form is available online, and the process involves interviewing the individual to assess for risk factors. If risk factors are identified, they must be referred for a TB exam by a licensed provider such as a nurse practitioner, physician, or physician's assistant. Next slide. Our goal is to avoid no-NIT policies, which unnecessarily keep students out of school. Early detection and prompt treatment are key to resolving an infestation. It is best practice that students not be excluded during class instruction, as it can make it harder for them to catch up and more challenging for families to return them to school. CS&O has resources for parents, including reminders about cleaning household items and bedding. While it's sometimes easier said than done, these steps are important for preventing reinfestation. Next slide, please. As we know, in many parts of California, temperatures can climb into triple digits quickly. The American Academy of Pediatrics and CDPH both provide guidelines for preventing and treating heat illness. If you suspect heat illness, act quickly. Remove excess clothing, move the student to a shaded or air-conditioned area, apply ice-cold packs or wet towels to the neck, armpits, and groin, and encourage hydration if the student is alert. Avoid forcing fluids if the student is unable to swallow safely, and be aware that axillary and infrared temperatures require adding 2 degrees and oral temperatures require adding 1 degree. Next slide, please. Prevention is always better than treatment. Encourage regular hydration and gradually acclimate the student to hot conditions. Monitor for signs and symptoms and take all reports of distress seriously. And please remind teachers to do the same. Ensure staff have a way to contact EMS and other staff, support staff quickly, especially if they don't work in a fixed classroom setting. This might mean having access to a cell phone or an iPad with cell service. I just want to take a moment to say thank you, and please make use of the California School Nurses Organization website for resources. We encourage every school nurse to join CS&O. Membership gives you access to trainings at significant discounts, continuing education opportunities, and a network of professional support. Non-school nurse health staff are also welcome to join. Thank you for the work that you do each day to keep students healthy, safe, and ready to learn.
Katie, you and your CS&O members and organization are amazing. Thank you so much for the wealth of information and knowledge that you provided. I just want to remind our friends on the Zoom that you will get a slide deck as well as a toolkit. Thanks again, Katie and CS&O. It is my pleasure now to introduce Dr. Tolley, who is a Harvard-trained licensed clinical psychologist, cognitive neuroscientist, and VP of Clinical Integrations and Partnerships at Kooth. They also serve on the faculty in the Department of Psychiatry at UC Davis with 17 years of experience designing and implementing digital mental health products for adolescents and young adults with serious mental illness, Dr. Tully has partnered with the state of California to launch multiple youth mental health tools, including universal screening for psychosis and early psychosis care support. At Kooth, they lead efforts to integrate the Soluna platform, free mental health support for Californians ages 13 to 25, into health, education, and community systems. Tully, please join me.
Good morning. Good morning. Hi, everyone. Thank you so much for attending. It's so wonderful to see so many of you here, and I'm excited to tell you about Soluna. Hopefully, for many of you, this is not the first time you're hearing about it. And for those of you where it is the first time, I'm really excited to bring this resource to your attention. Let's go to the first slide. So Soluna provides free mental health support to all 13 to 25-year-olds in California, and it's accessible via smartphone, tablet, or web. So really anything with an internet connection. It is available in English and in Spanish and includes self-guided resources and coping tools. So think informational articles on everything from anxiety to figuring out how to talk to your friends when there's a conflict to trying to figure out what it means to graduate from school. And think coping tools like breathing exercises, grounding, journaling, things like that. We also have a safe and pre-moderated community forum for peer-to-peer support. That's service user to service user. And I'll talk a little bit about how we keep that safe in a minute. And then the third part of it is our one-to-one behavioral health coaching. This is with real humans, real behavioral health professionals. It's available from 10 a.m. to 10 p.m. California time. And our young people can access it via in-app chat, so a bit like texting, or through video, or through phone. As I mentioned, the whole platform is available in English and in Spanish, and then we also do offer phone coaching in the additional 17 Medi-Cal threshold languages. And the behavioral health coaching, I'll talk a little bit about who those coaches are as well. Let's go to the next slide. So this is just a quick flash of what it looks like. You can see we've got the kind of self-guided support, the peer support, professional support as the coaching. And then I will talk a little bit about how our service users can also access other community resources through care navigation in a second. But let's go to the next slide. All right, let's talk about who our coaches are. They are certified mental health professionals, and we have three sort of categories or three types of certifications on that team. The first type is our certified peer support specialists. So these are individuals who bring lived experience of mental health recovery and other social challenges. And they've gone through a special certification process to learn how do they integrate that lived experience into their mental health coaching practice. Our second certification professional group is sort of general mental health support professionals. These are experienced practitioners. They may or may not have lived experience. They may or may not be using that as part of their coaching model, but they have a broad experience in supporting young people across a range of challenges. And then finally, we have a group of substance use disorder counselors. So this is individuals with specialty certifications who are specially trained to support youth with substance use challenges. And then all of these coaches are supervised by licensed clinical professionals. This is your licensed marriage and family therapist, your clinical social workers, and other clinical professionals like psychologists, etc. They provide training and oversight and risk management and safeguarding support, all the things that licensed professionals do to make sure that we're providing behavioral health services safely and at a really high quality standard. And what our coaches do very broadly is two things. They moderate and review for risk and safeguarding purposes any user generated content. So these are posts that are submitted to the forum or journal entries to make sure they're safe and savory and really aligning to community guidelines. And then they host the drop-in chats and scheduled sessions for that one-to-one behavioral health support. Let's go to the next slide. So safety is number one priority. We're working with some of our most vulnerable youth. We're doing it online. We want to make sure that everybody is taken care of in a safe and non-judgmental space. The first way that we do this is in that peer community forum where service users can post and support each other. It looks a little bit like an online forum, like maybe a Reddit, where a service user posts something, maybe they ask for help or they ask a question, and then other service users can respond in thread. So that's sort of what it looks like. There should be a familiar feel, but it's very different from that in that we do what we call pre-moderation. This means that anything that a service user submits to go into that forum, whether it's an original post or a response to another post, is first viewed by our coaching team, our clinical team, for safety and content, to make sure there's no hate speech, unsavory content, inappropriate content, and to make sure that that young person is safe. If there's any signs of risk, we work directly with the young person to keep them safe and get them access to resources, and to make sure they haven't unintentionally identified themselves in their post. Because, as you can see from the second bullet, Soluna has an anonymous model. So service user identity is protected. There's no way for service users to know or identify each other. And unless there is a safety or a risk scenario, our coaches also do not have the ability to identify the service user. However, in the instance of a safeguarding scenario, perhaps that service user is expressing suicidal ideation or other concerns, safety concerns, we have really robust safeguarding policies to manage that risk. And it looks the way that you will expect it to look in any kind of brick and mortar space. It's a gold standard protocol. First, we start with a risk assessment to determine that level of risk and the nature of it. And then based on that assessment, it leads us down a particular protocol path, everything from connecting to local resources all the way up to making sure that that young person gets to crisis services. One of the stories that my clinical team was sharing with me recently is that they did have a young person, school-aged person, who was experiencing pretty serious suicidal ideation, and the coach stayed on the chat with them while they took transport to the ER and stayed with them until they were connected to that crisis support team. So really just trying to demonstrate to you how important maintaining that safety is for young people. Service users cannot directly message each other in the app. There is no way for them to have private relationships with each other, and there's no possibility for inappropriate interactions or content sharing. It's only happening in that public forum space, which, as I said, is pre-moderated, and so there's no chance of anything unsafe being seen by other users. And then finally, and I think this is really important for us to know as educators, is that users can create a wellness and safety plan with their coaches that they can then reference during challenging times or crises. And this is a very classic safety plan. You know, what are my coping skills? Who are my support systems? What are the contact details of my treatment team? And where do I go if things get really bad? So that's something that our service users are using a fair amount. We're seeing people reference it on Friday evenings and again on Sunday nights. So as they kind of go into their weekend and prepare for their week. Let's move to the next slide. So the final bit I want to talk about is our care navigation feature. So this is a care navigation service team that connects youth to local support and ensures that they receive the care they need when they need it. We have trained care coordinators who ensure that they can get connected to care from an extensive database of carefully curated resources and vetted affiliate partners. And this is about whole person care and addressing social determinants of health. We can connect people to traditional healthcare as they need it. If they need a higher level of service for behavioral healthcare, we can connect them there. But we can also connect them to food supports or housing arrangements, transportation, legal and financial resources. And this is something we've seen a lot recently with the latest challenges around immigration enforcement and young people and families looking for resources to navigate that. Let's go to the next slide. Here are just some of our vetted affiliate network partners as of June. We've got 32 partners all across the state. We work with more community partners, but these are the ones that we have special friendships with, where we can do closed loop referrals and warm handoffs. So proud to see so many great community services here. Let's go to the next slide. And the next one, let's talk a little bit about data. So as of the end of July, we had 129,000 plus young people on the platform. I can share with you that that's now well over 132,000. And you can see on the right here, the heat map of the distribution of where those service users are. We've got service users in all 58 counties. And I'm really proud to see how well we've done in bringing services to folks in rural areas like the Inland Empire and some of those northern counties where we're really getting this service to people that historically have not had access to anything. Let's go to the next slide. Here are just some top line numbers around what it means to open up universal access to this kind of support for young people. We're seeing 45% of our coaching sessions happening outside of 9 to 5. So this is an extension of the services that schools and communities are providing. We know that mental health crises do not contain themselves to the school day, that young people can struggle in the evening. So this is really nice information there of how people are using it. 1 in 3 of our service users say they wouldn't have access to mental health support without Soluna, and 50% of them tell us that Soluna is their first time accessing those services. And we're reaching diverse folk and folk from underrepresented areas. 57% are from under-resourced communities as defined by the Healthy Places Index. 53% of users identify as Black, Indigenous, or a member of another community of color. And 48% are identifying as Latina or Hispanic. 85% of our coaching users are saying when they come out of a coaching session that they've had at least one of their needs met during that single coaching session, which is really a nice testament to the sort of solution-focused, agency-focused model that our coaches are using in those sessions. Let's go to the next slide. And just want to highlight a few quotes here. And I think really importantly, 82% of our service users are saying that they've realized they're not alone. They're not the only one going through these things. And that's a really important step in reducing stigma and creating safety for people to ask for help. Let's go to the next slide. The next few slides I have are tips and tricks on how to integrate this into educational settings. In the interest of time, I'm not going to go into the details, but I do really encourage you to reference them. Let's just look at the next slide as an overview, and then I'll close out. So I think one of the things that we've been talking a lot about as a community lately is how do we create healthy phone use, healthy screen use, and how do we create an educational environment where our students are able to focus on the things that are healthy and effective for them and able to turn away from things that aren't effective. We're not getting rid of phones. They're here to stay. So how do we redirect that behavior to be healthy? And here are 4 examples of the ways that Soluna can do that. Can they use it as a morning boost when they wake up at the beginning of the day? Perhaps some morning affirmations, perhaps some mood journaling. Can they use it during their commute to kind of soothe their nervous system, do a breathing or relaxation exercise? If they're sitting around waiting for something, class to start, an appointment, in a queue, can they peruse the forum and respond and support their community? And at the end of the day, is there an opportunity to journal and reflect and kind of track our emotions and how we're feeling? So just some examples there. Let's go to the next slide. And then here are some ways, if you're doing social and emotional learning or weaving some form of mental health support into your curriculum, here are 3 types of self-care that we know really help us as humans to navigate the world, particularly as adolescents. We want to have self-soothing behaviors. So think those breathing exercises, those scents, that bubble bath, that soft blanket, all those things that you have in your life that make you feel good and can soothe your nervous system. Provide immediate comfort. Mastery behaviors, so building confidence and purpose through a sense of accomplishment, getting those tasks done, organizing things, cleaning your room, making that phone call. And then community behaviors, engaging with your community, supporting people around you just as they are supporting you. These are 3 ways of taking care of ourselves. And the next few slides, which we'll skip through, are very clear ways that Soluna can guide young people in developing all 3 of those behaviors. So let's just flip through those because I know I'm taking a bit more time. Please do take a look at them. And I'll just finish off with encouraging you to follow us on socials so that you don't miss any information about where we're at, our community events, what we're doing. And you can check out more information about the impact of Soluna in our communities at the website linked here. Next slide. If you want to test it out, you can also download our demo version of an app. If you don't fit into the demographics that Soluna serves, you can use this demo, which is a mirror of the real platform. And I think that's it. I think that's me. And I think I'll say thank you very much for listening and thank you for the work that you do. And I will answer some questions in the chat.
Yeah, thank you so much, Toli. I absolutely cannot express enough of this incredible resource and Toli's leadership on it. I was a former high school principal, and I always share this story. We were desperate for those type of resources. I would have the students pull out their phones at that time, and I'd say, let's open, I would do it at a rally. Let's open it up. This is a resource for you, knowing that some students don't have that kind of access. It is an incredible resource. I'm going to share a little bit more about it. I dropped into the chat that there is you can download resources or ask for a resource care package. And we received it here at the California Department of Education. And when we were in conversation with some of our partners, and a student was asked how they found out about the resource, they said they saw the sticker. Oh, I don't want to show you on a teacher's water bottle. So it's not just the students that are raising their hands saying, I'm having trouble with my mental health. It's the students who are sitting quietly and saw a water bottle with a sticker and decided to go for that resource. I would put the what is that called? What's that QR code? In bathroom stalls, because we know that's very, it's confidential space. A student could scan it. Maybe they don't want to go stand in a line and wait for a counselor in the admin building. But I cannot express how great of a resource this is. And totally, there are some questions. It is a free resource, but there's some questions if you won't mind popping in and answering it. And thank you for sharing space. I always adore time with you. So thank you.
It's always a pleasure. Thank you so much. And I'm typing away at those answers. So thank you everybody for your questions. Really appreciate it.
Okay, thank you. So now we have a back-to-back dynamic duo. Following Toli, we have our very own Dr. Mary Beth Boyer, who is California's content expert around suicide prevention, intervention, and postvention. And she will share, I always struggle with that word postvention, but it's a good reminder, but a good postvention is an intervention. So a little bit about Dr. Mary Beth Boyer. She is an education program consultant at the CDE and the Office of School-Based Health Programs. Her focus is on behavioral health and suicide awareness. Dr. Boyer holds a doctoral degree in educational leadership and a master's degree in cross-cultural teaching. She has served as a school administrator, has taught in both public and private school at the primary, secondary, and post-secondary levels. With certification as a youth mental health first aid instructor and professional certification in trauma and resilience, Dr. Boyer is dedicated, committed to equipping educators with the tools they need to effectively support student and staff's well-being. Dr. Boyer, would you please join me?
Thank you, Carrie, for a wonderful introduction. And thank you, Katie, for sharing all things school nurse. And thank you again, Toli, for a wonderful share on Soluna. I'm going to go a bit into legislation. While it's not as exciting as what we just saw, it is important. So I'm going to be talking about what you may have heard in the past referred to as SB 153. And that was a trailer bill last year, which modified two ed codes. So we're going to talk about these two ed codes because they apply both at the state level and at the local level. And these two bills, I'm sorry, the two ed codes are 49428.1 and 49428.2. Next slide, please. So the first code that I'm going to share with you all is 49428.1, and you do not need to memorize these numbers. I just happen to have, having worked on this for about a year now. So the first ed code is 49428.1, and what this required was that the state, so as CDE, had to post model referral protocols for pupil behavioral health concerns. That's a mouthful. And we needed to post that by June of this year. And you will find that on our website. You'll also find it in the chat as well. And what these protocols required CDE to do was create these referral protocols in consultation with other stakeholders. So when you look at these protocols, you'll understand that we consulted with our School Mental Health Policy Work Group, Department of Healthcare Services, faculty, staff, teachers, parents, PPS credentialed, and school nurse credentialed, as well as students. So a lot of stakeholder input went into these protocols. So you'll be able to, again, find these protocols on our website and in the link. Next slide, please. And so again, just a little bit of background on what drove these protocols. In legislation, it required consultation with the entities that I just talked about, and for us to look at the SAMHSA toolkit, which SAMHSA is Substance Abuse and Mental Health Services Administration, and they have a behavioral health referral pathways toolkit. And I share this with you because you'll see in the next slide, in the next ed code, is that at the local level, LEAs will also have to create their own model referral protocols. So we'll see in just a moment that you're encouraged to also look at this toolkit. And if you want to read the entire bill that guided these ed codes, it's again, Senate Bill 153. You'll find these ed codes embedded in that trailer bill. It is several hundred pages. If you have that time, feel free to read it. But if you just want the ed codes, we will share those ed codes out as well. Next slide, please. So the next ed code that I'm going to transition to is 49428.2. So point 1 was the onerous on CDE, what we had to do. Now what I want to share with you all is at the local level, what LEAs are responsible for. So before we go into that piece, I just want to highlight some definitions that you will find in ed code and make sure that we share these with you so you understand what is driving the policies and the trainings. So ed code has specifically defined youth behavioral health concerns to include both mental health and substance use disorders. So when you look at the protocols that CDE created and the protocols that you will be called to create as well, it needs to include reference to both mental health and substance use disorders. It also calls out youth behavioral health training. And legislation has provided a definition of what that looks like. And we just want to share that this is the minimum requirement for training, the bare minimum. When we think about what our youth need, it's more than just what's defined in legislation. So, but we're sharing the minimum, and then we're going to share a little bit more of what it can include. Next slide, please. So the ed code 49428, there's 2 prongs to this ed code that LEAs will be responsible for. The first prong has to do with developing their own policies, and the second prong has to do with training. So I'll talk just a little bit about the policy. So LEAs are required by January of 2026, so the end of January, that LEAs adopt their own referral policy for addressing pupil behavioral health concerns in grades 7 through 12. So when you read that, think back to the prior slide where we defined behavioral health as both mental health and substance use disorders. So the referral policies will need to address both of those. You have the option of using the protocols that CDE developed. And again, those are on our website. You also have the option of using the SAMHSA toolkit. And I just want to share out the toolkit is dated. It's from 2015, but it was called out in legislation. So I just want to make you aware that the toolkit is there, SAMHSA's toolkit. It is dated. It does have some good information. So feel free to look through that. The protocols that you develop at your local level must address your high-risk groups. So take into account what your environment is, what your community is, and be sure to address those high-risk groups. And think about high-risk groups, special populations. Think of students with disabilities, mental illness, substance use disorders, foster care, the unhoused. So your policy has to reflect your community. And again, it's the behavioral health for grades 7 through 12. So that's the policy piece that LEAs are called out to do. The next part that legislation requires has to do with behavioral health training. Next slide, please. Okay, so the behavioral health training, can you go back one slide? I think okay, go ahead, sorry. There you go, sorry about that. So the behavioral health training requirement in legislation requires that all LEAs certified as CDE, that 100% of certificated and 40% of classified staff who are in contact with students in grades 7 through 12 must have received youth behavioral health training. You have until July 1 of 2029 to meet that mandate, but I encourage you all to start sooner than later. Our youth, our students need to have you have the understanding that this training calls out for. The training is called out in legislation. I spoke in an earlier slide about the bare minimum, but legislation outlines the options, and we encourage our LEAs to look at the options to be included in training. And again, you can find that in the Ed Code. So again, it's 100% certificated, 40% classified, certified in the youth behavioral health training by July of 2029. So to recap, kind of a lot of information in a short period of time, the two Ed codes are shown on this chart here. The first Ed code was the responsibility of CDE. That needed to be met by June 1. That's the model referral protocol that you'll find on our website and in our chat, and it'll also be shared out in the toolkit, thanks. And then the second Ed Code Point 2, that's a two-pronged requirement at the LEAs. The first part is that you develop policies on referral protocols for addressing pupil behavioral health concerns, grades 7 through 12. That's due again by January of 2026. And then the second prong for our LEAs is to certify the training. And again, that's due by July of 2029. And you can find the specifics related to the training and the protocols in Ed Code. And we've shared that out. And again, you will have it in the toolkit. And thank you again for joining us. And thank you again for all you do for our youth.
Thank you, Dr. Boyer. What an amazing work is being done and guidance for our LEAs. I am next pleased to introduce Ryan Skaggs, who is a father of two and the program director of the California Department of Public Health Office of School Health. Since joining the Office of School Health, Ryan has led various school health programs and initiatives, including state guidance and policy updates and the development of the epinephrine standing order. And since starting with CDPH in 2017, he has served in a variety of roles, including strategic planning coordinator, internship coordinator, and program consultant with the CDPH Office of Oral Health. Ryan is a Clinton Global Initiative University Fellow with a background in environmental justice, community organizing, nonprofit management, and HIV client services. Ryan, we are so happy to have you here. Please join us.
Yeah, thank you, Pam, and I'm happy to be here as well. I want to thank the CDE team for allowing me to present today. As Pam mentioned, my name is Ryan. I use he, him pronouns, and I am the program director of the California Department of Public Health Office of School Health. Many of you may better know us as Safe Schools for All. We continue to proudly serve California school communities, and hopefully some of the resources and materials we're presenting today will be a great use for you as you plan this back to school time. Next slide, please. So first off, what is the Office of School Health? I would say first and foremost that we are a resource to you. We believe in supporting healthy, safe, and supportive schools for all Californians. And how we do this is to serve you and help you do your job to the best of your ability. We've been serving California schools since the days of COVID-19 when we were known as Safe Schools for All. And we're committed to helping you do your job easier. So some of the things that we do is we develop and provide scientific guidance and policies. We've been doing this since the early days of the pandemic. First with COVID-19 specific guidance and policy, now focused on a broader range of health topics. We support school-based health centers, facilitate collaboration between state and local health officials. And one of the big ways we do this is in our biweekly office hours webinars and weekly notes emails. We also lead and implement school-based behavioral health programs, and we provide training and technical assistance to schools. So we'll cover some more of these items in greater detail in just a moment. Next slide, please. So one of the big things I want to highlight today is our TK through 12 communicable disease mitigation guidance. As I mentioned, our work on communicable disease mitigation guidance builds on our experience leading the state's efforts to help support schools safely reopen after some of the initial closures earlier in the pandemic. We're really committed to help keep schools safe and ensure that schools are a safe environment for students to meaningfully contribute during in-person learning. The TK through 12 communicable disease guidance is a great resource. Many schools, districts, and county offices of education use it as a template for developing their own policies. As with all our guidance and policy, we strongly recommend building a relationship with your local health department if you don't already. And also want to highlight that some local policies may be more comprehensive than what the guidance and policy that we put out. But this should be an easy to follow guide for schools and licensed childcare facilities, early education sites, before and after school programs, and intercession programs. You go to next slide to get a little bit deeper understanding of some of the things that are contained in our guidance documents. So a lot of general information and general considerations, information about school immunization, indoor air quality, face masks, hygienes, symptoms, infectious disease reporting, cleaning facilities, testing, and other areas. It's important to recognize that following the pandemic, our state has merged a lot of our COVID-19 specific guidance and policies into other more broad communicable disease guidance and policies. So if you're looking for the latest up-to-date information around school guidance and policy around COVID-19, this is where you would go to find that. Next slide, please. Another one of the guidance and policy documents that we manage is the symptom management guidance. This is a product that really emerged following some of our conversations with school nurses and school admins. It became clear that there was a lack of consensus about what conditions a student with symptoms may be able to safely contribute during in-person learning. I think we noticed post-COVID, there was a large problem of student absenteeism and definitely a lack of clarity around what circumstances a student may have to be sent home if they were exhibiting symptoms. So to develop the symptom management guidance, we partnered with the American Academy of Pediatrics, and we created a guide that's easy to use for parents, teachers, school administrators, and others to be able to make some of these tough decisions. So again, this guidance applies to TK through 12 school and childcare settings with the intention of supporting safe in-person instruction. You can use the symptom management guidance with, contains a broad set of general recommendations. There are also references and resources that you can use to send to parents, posters, quick sheets, and other links. Next slide, please. This is an example of a table that's included as one of the annexes in the symptom management guidance. So, symptoms like fever, vomiting, diarrhea, runny nose, You can find a broad range of symptoms here, and it should provide an easy to follow reference for considerations on whether a student should stay home or what conditions they can safely resume or learn in person. Next slide, please. One of the other big things we do is maintain statewide standing orders for emergency use medications. Our epinephrine standing order was launched last year in 2024. This has been a great resource and has been widely adopted across California schools as the de facto means to obtain epinephrine autoinjectors or EpiPens without the need for a physician's prescription or a local standing order. I believe we're at about 9,000 of California's 10,000 TK through 12 schools have adopted our epinephrine standing order. One of the big things we have coming down the pipeline is our albuterol standing order. So this is really exciting. We will be launching this on our webinar on September 16th. So we're really excited about the albuterol standing order. We hope it will be very much a game changer that it removes a lot of the access barriers that schools have faced when stocking albuterol, multiple dose inhalers, and disposable spacers. Next slide, please. So our epinephrine standing order, as I mentioned, authorizes access to epinephrine autoinjectors. We encourage schools to partner with the EpiPen for Schools program, which provides free epinephrine autoinjectors to schools. Schools can use our standing order to obtain standard dose epinephrine autoinjectors as well as the junior doses, which are required under ACO to be stocked in elementary schools. So this eliminates the need for schools to obtain a local physician's prescription, and our standing order can be used to obtain up to 4 autoinjectors per calendar year. Local education agencies, county offices of education, and individual schools are eligible to apply. Our online portal that was just put in the chat can be used to apply for a standing order. And then a standing order can be used to obtain emergency medications. As I mentioned, EpiPen for Schools is a great resource. Also some other online pharmacies, including School Health Supply, accept our epinephrine standing order. So please reach out to us if you have any questions. And we'll put our group inbox in the chat. Next slide, please. Again, our albuterol standing order is coming September 16th. So this is going to be a huge deal. As part of our albuterol standing order, each school is eligible to obtain 2 inhalers and 25 disposable spacers. Refills are allowed. Just like our epinephrine standing order, local education agencies, county offices of education, and individual schools are eligible to apply. Next slide, please. One of the other things our office does is develop and facilitate online self-paced trainings. We also partner with others who develop trainings. One of the big trainings that we've been promoting lately is the Safe Spaces training, which was originally developed by the California Office of Surgeon General and is currently maintained by the CDPH Office of School Health. The Safe Spaces training has 3 modules for professionals who work with children and youth. Modules are targeted towards different individuals by different age bands. So we have training modules for folks serving children ages 0 to 5, 5 to 11, and adolescents age 12 to 18. The training is really heavily oriented in helping to recognize the signs of adverse childhood experiences, learning more about how those affect children and youth, as well as strategies to support students. So we'll post a link in the chat to visit that training. The training is about 2 hours. It's self-paced and online. If you can't complete the training in one sitting, you can come back and it will maintain your progress. So it's a wonderful training for all folks who work with children and youth, so highly recommend it. Next slide, please. And these are our office hours webinars. As I mentioned earlier, we continue to host bi-weekly webinars. Attendees can expect information on TK through 12 health guidance, resources, programs from local education and health partners. We will be starting these back up next week, and we'll be continuing to host these webinars every other Tuesday from 2 p.m. to 3 p.m. A lot of opportunities for audience question and answers with subject matter experts, as well as opportunities to interact and network with other colleagues from around California. So it's a great opportunity if you work in a school to meet some folks from your local health department, to meet others who are working in school health statewide. If you are interested in attending our webinars, please send us an email at sayschoolsteam@cdph.ca.gov. We're looking forward to having you. Next slide, please. Here's some other resources that should be able to help you do your job better. Definitely recommend, as part of subscribing to our listserv, receiving our weekly notes emails. So we send these out every week on Tuesdays. These include webinar summaries from our office hours, including slide decks, speaker information, and other relevant information that's shared during our webinars. We also share information about upcoming events, trainings, grants, and other key resources. So these are really designed for you to share with your networks. We design it in a way that you can cut and paste content and put them in your own emails and easily share them with others. Just like our webinars, if you would like to subscribe, please contact us at sayschoolsteam@ca.gov. We also maintain our School Hub website. This is an excellent one-stop shop for all things school health related. This hopefully eliminates the need for you to use Google, AI, or other search methods to find resources that may not be always reliable. This is a website that we curate that is evidence-based and that you can trust has the most valid, recent, and up-to-date information. That's schools.cdph.ca.gov. Please visit it and bookmark it. Next slide, please. These are some of our upcoming webinars, so hopefully you can join us next week on our Welcome Back webinar. We'll talk more about the Office of School Health, some of the tools and resources that may be of interest to you. In September 2nd, we'll be talking about suicide prevention in schools, and then on September 16th, we'll be excited to have our albuterol standing order launch webinar. So I want to thank you for all your commitment to making our schools healthy, safe, and supportive, and your commitment to student health. We couldn't do what we do without folks on the ground such as yourself. So happy to serve you. And please reach out to us if there's anything that we can do to help make your life easier. As I mentioned, we maintain a TA inbox. So reach out to Safe Schools team at cdph.ca.gov if you have any school health issues. Happy to help you out. We have an amazing connection to some of the best subject matter experts in the world here at CDPH on various public health topic issues. So if we can't provide an immediate answer to any questions or inquiries that we have come in, we do our best to close the loop on all TA inbox requests received and provide warm handoffs to subject matter experts. So thank you for allowing me to present today, and please follow up and reach out if there's anything that we can do to help you. Thank you.
Thank you so much, Chief Skaggs. I cannot express what an incredible resource that he and his team are to all of our school communities. I highly encourage you to join the listserv, Ryan. There's some questions in there about that process, and attend their webinars. And I can say, having the view of the entire state, when there is an urgent need within the state, he's extremely responsive and can convene a team faster than you could ever imagine. We work with them very closely. Love this last slide, Chief, very sweet. And he is also part of developing another resource to meet the requirements of Senate Bill 153, And as far as the mandated 100% of certificated and 40% of classified. So we're working very closely, Dr. Boyer and the team here with Chief Skaggs and his team, but an incredible resource. So I highly encourage you to, is it called subscribe to the listserv? Sorry if I'm not using the right term, but be part of the listserv and attend their meetings. They're invaluable. I'm going to go ahead and thanks, Chief. I'm going to go ahead and transition now to our very own Sarah Eaton that I have the pleasure of working with every single day and working for. She is an associate governmental program analyst. She earned her Bachelor's of Arts in English from California State University, Sacramento. Her passion for education and youth advocacy drives her work and informs her approach to policy and program development. I have to pause to say having a Gen Z perspective has been incredibly useful in this office. So helping us link the bridge or create that bridge has been very meaningful and authentic. Sarah's committed to making a positive impact, and she does, in her field, and continues to work towards advancing the well-being of children through her professional endeavors. Sarah, would you join me?
Thank you so much, Carrie. And I just want to highlight a great resource and great training that we provide here at the California Department of Education, specifically in our Office of School-Based Health Programs. And as we prepare for a new school year, some of us are already back in the classroom, we want to highlight Youth Mental Health First Aid. And again, this is a wonderful no-cost training that is offered here at the CDE, thanks to the very generous support of Blue Shield. This training is designed for adults who work with youth, young people, ages 6 to 18, and it teaches participants how to recognize the signs and symptoms of mental health challenges. It offers initial supports and reassurance, and it also connects students to appropriate resources, whether they're experiencing everyday stress or a serious crisis. We offer this training in different formats, such as virtual, hybrid, and in person. It is also offered year-round. And here at the CDE, we handle all of the logistics from scheduling registration, making it easy for your school, your district, or your organization to bring this training specifically to your staff. And we really wanted to highlight this with Mary Beth Boyer's presentation on the Education Code of Senate Bill 153. And we here at CDE have seen the difference that Youth Mental Health First Aid training can make. Participants tell us that they leave feeling more confident in having supportive conversations, expressing concern, and taking action when a young person is struggling. Because as we love to remind people in this office and at this department, every child is one caring adult away from changing their narrative. If you would like to sign up for a training or learn more, please contact us at our office inbox. That is osbhp@cde.ca.gov. And we will share that inbox in the chat as well. I just want to thank you for your time today, and I'm wishing everyone the best back to school for this upcoming year. And with that, I would now, it's an absolute honor to introduce one of my colleagues that I have the pleasure of working with every single day, and that is Pam Kahugam. Pam is the school health education consultant within the Office of School-Based Health Programs at CDE and is charged with leading social emotional learning and mental health, and joined our team a couple of years ago. Back in a couple of years ago in October. Pam has over 20 years experience in implementing and coordinating student support centers, serving the mental, social, emotional, and physical health needs of students and families in Sacramento City Unified School District. Please welcome Pam.
Thank you, Sarah, and good morning again, everyone, and welcome back to a brand new school year. Assembly Bill 10 is authored by Assemblymember Josh Lowenthal and was signed into law October 23, is now a part of our California Education Code. This bill gave the California Department of Education a clear and meaningful charge to develop a model policy and provide resources to address the very real issue of body shaming in our schools. Next slide. Thank you. Our Office of School-Based Health Programs, we took this responsibility to heart. We work closely with our dedicated partners across the state. We created a model policy and curated resources that schools and districts may use to educate staff, students, families, and the entire community about body shaming and how to prevent it. Next slide. From the very beginning, we knew this policy had to reflect the lived experience and expertise of young people. We worked side by side with the Tulare County Office of Education's Project Aware Youth Advisory and received input from All Children Thrive California. These young people, they did more than just advise. They did shape the heart and soul of this work. Their honesty, their courage, and their insights were truly transformative. Together with partners, we co-created a shared definition of body shaming. One is that's clear, inclusive, and grounded in real life experience. Body shaming is the mocking, stigmatizing, or commenting on a person's body or appearance, which is perceived as negative, whether about someone else's body or one's own. Regardless of intent, it includes opinions, comparisons, observations, or gestures that cause emotional or mental harm, and that demean, judge, or marginalize someone based on their body or physical appearance. It can happen verbally, non-verbally, online, on social media, and it can escalate into bullying, harassment, and even violence. And so when you hear it described this way, we realize how urgent it is, and we need to address it. Next slide. And so we know that students learn best when their emotional, physical, psychological, basic, and social needs are met. And before a young person can focus on academics, they have to feel safe, they have to feel accepted, and they have to feel supported. When students experience shame, discrimination, or exclusion, especially about something as personal as body size, shape, or appearance, it can chip away at their sense of belonging. It can shake their confidence, and it can affect their readiness to learn in ways we sometimes can't even see. This policy isn't just about stopping harmful behaviors, it's about building school environments where every student, every staff member, everybody who walks in the door feels respected, valued, and empowered to be themselves. Next slide. And we didn't create it in isolation. Our model policy and resources were built through partnership. We are deeply grateful to the Behavioral Health Services Oversight and Accountability Commission, wait, that's a mouthful, to California Health and Human Services and the California Department of Public Health. But most importantly, we honor our youth who bravely shared their stories, challenges, and hopes. And their voices are shaping a safer, more compassionate future for all California students. And now it's up to us, all of us, our LEAs, our schools, our communities, to take this work forward. Please use this model policy, adapt it to your local context, engage your students and families in the conversation, and together we can make sure that every student in California, everybody, staff, community, anybody who walks in the door feels safe, respected, and supported. Because remember, every child is one caring adult away from changing their narrative.
Thank you so much, Pam, for sharing that information. And Pam, there was a comment in the chat when you have a chance to answer it. That would be wonderful. I have the honor and the pleasure of introducing Dr. Sohail Sood. And Dr. Sohail Sood serves as director of the Children and Youth Behavior Health Initiative. That's what he puts in his bio, and he does so much more. And he's such an incredible resource and content knowledge pediatrician that provides statewide guidance to support our students. Prior to this, he led school health and chronic disease programs at the California Department of Public Health. He's also a pediatrician and father of 2 kids in our California public schools. Dr. Sood, would you join me up here?
Thanks so much, Dr. Sequeira. It's a pleasure to be with you all today. I'll note I'm joined by my colleague, Cheyenne Long, who'll be putting some links in the chat as we go along here. But for those less familiar, the Children and Youth Behavioral Health Initiative is a multi-year, multi-billion-dollar effort to transform the way we support our kids and our families. And I'm so grateful to partner with all of you in this effort. We can go to the next slide. So to do this, we have to meet youth and families where their lives play out. And certainly this includes the healthcare sector, but it also means homes, communities, the digital space, and schools. And so, as I mentioned, it's been an honor to partner with you. You get it. I mean, you're on this call. Well-being and academic performance, they are so interconnected. The mind and the brain are not separate entities. And so let's get everyone healthy and ready for this school year. We can go to the next slide. What I hope to do over the next short period of time is just provide a brief overview of some of the offerings we have for 3 categories of folks. So hopefully there's something in there for you, no matter who you are on this call and where you're joining from. We can go to the next slide. Starting with administrators and care providers, I'll say it, sometimes these folks don't get enough credit for the behind-the-scenes work that they're doing to facilitate access to care. Recently, I had the opportunity to connect with Superintendent Greger and his team at Yuba County. They are establishing partnerships. They're renovating spaces. What you see in the background here is the new Zen Den at one of their high schools. They're seeking out funding sources, all in service of kids. And we can go to the next slide. The schools in Yuba, they represent some of the more than 500 that are now participating in various stages of our fee schedule program. And so I know many of you are likely tracking this on the call, but in case not, this is one of the ways that California is connecting the services that schools and their community partners provide, if we go to the next slide, to the healthcare system. This is really a recognition that these are healthcare services, behavioral health services, and we can contribute to the sustainable financing of these services and even the possible expansion of them if we connect the funding to the healthcare system. So essentially to get reimbursed from eligible health insurance plans, which include the vast majority of those that service the state of California. So we can go to the next slide. But at this point, what I can share is that more than $1 million is being processed in terms of claims, with more than 400,000 already being remitted back to schools, and thousands of students at this point are receiving services that are financed through this first in the nation approach here. So this school year, the one that just started this week for my kids, promises to really be a year of significant growth. And if you want to hear the latest about this, come join us on September 10th, 2 to 3:30 p.m. for a webinar hosted by my colleagues at the Department of Healthcare Services, who are going to delve into the details, give you the latest status updates, and provide a wealth of important information there. We can go to the next slide. So to navigate the fee schedule and just service provision in and around schools, particularly with community organizations and other partners, it's important to understand those nuances of the regulations that govern privacy and information sharing, because we have to do both, right? We have to share information between partners to coordinate care and even to bill in some cases, but we also have to maintain the privacy and the rights of really those receiving those services, those children, those youth, and those families. And all of that, as you probably are very familiar with these acronyms, HIPAA and FERPA. So the rules that govern that space in the federal space, they have implications for the way we design and roll out services. And pleased to really share that we've released a new toolkit to help folks understand this nuance a little bit more. It contains guidance, it contains case examples, and a link to that is located here. We're also in the works of getting some webinars up in order, and we'll share more information about that to just walk folks through this new and hopefully really practical operational guidance for all of you. If we go to the next slide, another consideration really for providers and administrators is to consider including wellness coaches within your team. And for those not tracking this is a new, essentially an entry-level behavioral health specialist position. So for which some of your staff might already be eligible. These are the folks that are often working with the licensed professionals, with the supervisors, and hopefully allowing everyone to work at the top of their game and freeing up some space for everyone to focus on the top again of their scope. So some of your staff at schools may already be eligible. And if you get them certified, then some of the activities that they do may be reimbursable through the fee schedule. So again, reference folks back to the webinar coming up for more information about that. But if you jump to the next slide, I'm happy to say that we are starting this school year with more than 2,500 Californians already certified and working in many cases in schools that you work at or in communities around you. So again, head to that DHCS webinar to learn more about all of these pieces. And we can go to the next slide. For the educators and the school staff out there, I want to start by sharing gratitude for all that you do. There are amazing folks like Dr. De La Cruz who teach and they lead with love. And I think that that is so foundational. And as we think about behavioral health, I am delighted to share on the next slide some opportunities that develop skills that build upon that love, right? It's the heart and the brain working together to support our kids. The first course is the one you just heard about from Chief Skaggs at the Office of School Health. So I won't cover that other than to just say, again, it's a tremendous, fantastic course. I've taken it myself that really teaches that biology of stress and that understanding that we all take an important role in creating those safe, stable, nurturing relationships. The one on the right is called Open Doors. It's a newer course and it focuses more on substance use. And I really just love the insight it provides on the history of our society's approach to substance use and really what we need to keep in mind when we're thinking of kids that are turning to vape pens, that are turning to pills, that are turning to Snapchat in some cases to get those types of things. So it's a hybrid course with an online portion and an in-person portion. And head to opendoorstraining.org to learn much more about that. And if we go to the next slide, for the students and the families, you are the reason we're all here today. So appreciate the words of folks like Eduardo who remind us that behaviors, particularly in adolescence, they're influenced by our peer groups. And if we can get young people aware of suicide prevention resources, we can make such a tremendous impact, as well as other very important behavioral health resources. So if we can go to the next slide, there are many, many different resources that have been brought forth through this initiative, and they will do nothing if they live on a shelf. So my ask of all of you is to pick a few, learn a little bit more, and share the word out. I won't go into Soluna because Dr. Tully did an amazing job sharing all of the resources that are available through that. I'll just note Bright Life Kids provides very similar support, but to a different group of folks. So this is for the families, for the parents, and for those kids, their ages, under 12, 0 to 12. My kids themselves have learned a lot through the coach that they're working with on Bright Life Kids. The current concept was the circle of control, right? There are things I can put in that circle and there are things I can't. So really just foundational understandings that help us navigate the world and the stresses of this world. Mirror on the left on the screen here, mirrorjournal.com, another totally free app available in English and Spanish. And this is a private space. So this is for the folks who turn to journaling to process. And we know that sometimes you just feel very unorganized and have to spit out whatever you're feeling as quickly as you feel that way. Mirror is a place that you can do that. You can do that through texting in the app. You can do that through a video recording of yourself, or you can do that through a voice memo. And it will take out whatever you're feeling, and it has some adaptive technologies that will summarize it back to you. So you can almost get a better sense of the organized thought patterns and the ways that you're thinking about things. You can also chart your mood in that. And, I encourage folks to give it a shot and see if it's right for them. It will also nudge you to your own self-identified circle of support. It will nudge you to Soluna, if you really think that connecting with a professional is the next step of what you might need in any particular way. And if you can go to the next slide, in addition to these on-demand digital resources, there are a number of great other tools and resources that raise awareness and reduce stigma. So Live Beyond is a great place to really learn about ACEs and to hear from Californian youth who've been through this and how they are living beyond it, right? Never a Bother, a great place to learn much more about suicide prevention activities. On the back of your IDs in school, right, says the number's 988. What does that mean? What happens when you call 988? What are the warning signs of suicide? Those are all the types of questions that this campaign addresses. Positive Parenting Thriving Kids is really just a fantastic video series where you can learn a lot to address all of these common parenting challenges, dealing with emotions, dealing with identity issues in so many different ways. And then Take Space to Pause is a great kind of 101 about stress and about the tools that we can use to manage that stress. Through that, you can create a pause plan. So again, as you think about your school year and plot out the different ways you want to engage in mental health resources and activities, I just encourage you to consider all of these campaigns and efforts. And if you go to the next slide, the best place to start off and to provide and share that information are one-page flyers that we've created. These are available in English and Spanish. You can share them out digitally and they have hyperlinks, or you can print them out and they also have QR codes. So whatever way works best for you, you can find these in our new Back to School Toolkit, which the resources are available here on the chat. And then with that, I just want to close with some optimism. So if you go to the next slide, it is always tough to get very recent data, right? It takes a while to ensure the integrity and the quality of the data. So these are preliminary findings. And huge thanks to the next presenters from the Department of Education for their efforts to administer the California Healthy Kids Survey. But overall, I'm taking some hope that we might be emerging from this recent cloud of despair, right? Rates of self-reported sadness seem to be decreasing over multiple years now. And that's to say that kids are responding to survey questions that essentially mirror the clinical definition of depression, right? Feeling so sad or depressed for a period of 2 weeks over the course of a year that they stopped doing usual activities. The kids that are saying that they have felt that way are decreasing over time. It's still too many, but again, a movement in the right direction, as are those who say that they have seriously considered a suicide, with lowest reported numbers in the past 9 years for 11th graders. Might not be always the case with how adults are feeling, but if you jump to the next slide, youth also appear to be increasingly optimistic, right? They are agreeing with statements that say, I expect to have a good day. I'm looking forward to having fun. We're seeing upward trends in life satisfaction and optimism from these youth. And so I'll just close by saying that's what we need to center on. That's what it's about, right? The optimism about one's potential and how all of us in this call can really lift up our youth to achieve their dreams. So thank you again for your time. Again, the homework I'm hoping to assign is that you engage in these resources, you check them out, and you share them. Great to be with you. Take care.
Thank you so much, Dr. Sood. Always amazing, great information. And like we have said, you will get the slide deck and all the links in the chat will be shared in our toolkit. Next, I'd like to introduce Dr. Tom Herman, who has been in education for over 30 years, serving as a high school teacher, coach, mentor, teacher, vice principal, and principal. And for the last 17 years, Tom has been an education administrator managing the School Health and Safety Office at the California Department of Education. Tom's responsibilities have included overseeing school safety, crisis response, bullying, and school climate, as well as the California Healthy Kids Survey. Also, Dr. Herman's areas of responsibility include HIV and AIDS education, the California Healthy Youth Act, and the Youth Risk Behavior Survey from the Center for Disease Control and Prevention. Dr. Herman also served as a member of the California School Conditions and Climate Work Group. Welcome, Dr. Herman.
Thank you so much, Pam, for that nice introduction. I am just honored to present today and present with our state partners and stakeholders. And I want to thank also the Office of School-Based Health and Carrie Sequeira for putting this together, and her wonderful staff also. Next slide. So as was mentioned in the introduction, the School Health and Safety Office concerns itself with school climate and culture. We have various programs that I want to very briefly share with you. The Bipartisan Safer Communities Act, which is a federal grant designed to improve school climate and school safety among those selected schools. That has been underway for over a year, and we are getting already seeing great results in terms of improving students' feelings of connectedness, school safety, and making actual physical changes in schools. And this was with federal money, and it was a very competitive grant. Also, of course, we have the Cal Schools, or the California Healthy Kids Survey, which is a broad-based survey that looks at all sorts of youth risk behaviors. And included, we have mental health modules, school climate modules, social emotional learning modules. And so I encourage you to look at those surveys and then inquire of your own school districts about that survey and what are you doing with the data that you're getting. And also we have the youth risk behavior surveillance system, the YRBS. It's essentially it's very similar to the CHKS, but it is only in taken in a randomized set of schools biennially, so every other year. And so we just got done with the last year's administration and are expecting results to come through for that. It often mirrors the results we get from the California Healthy Kids Survey. And in alternate years, when we're not giving the youth risk behavior survey from the Centers for Disease Control and Prevention, we're giving the school health profiles, which surveys the main sort of principal adults on campus that are responsible for things like the California Healthy Youth Act and health classes. And so we get great data from staff in terms of how they're implementing their school health programs. And we also have the school safety and comprehensive school safety plan. So within our unit, the CSSP, or the comprehensive school safety plans, are always due each year by March 1st after their board approval. And then also it needs to be reported to the superintendent of public instruction if the safety plans have not been turned in by October 15th. And feel free to inquire any details regarding those plans to our unit in the School Health and Safety Office. Each year, it seems more and more is being added to those school safety plans. This year, they've added the instructional continuity plans. And so those are plans in place designed to have instruction continue through various natural disasters, fires, earthquakes, floods, etc. And so schools now are required to have such plans in place. And we provided great guidance that we put on our web pages as of March. And so those are can be viewed and offers people guidance to create those plans. Also within our unit, we share mandated reporter training information. We post cross links to the Department of Healthcare Services, and so that all staff are aware that they have to take the training, and LEAs have to provide that training. And then also we have in our unit Project CalStop, which is from the Department of Justice, and that is aimed towards violence prevention and mental health training among staff and in selected schools and counties. And then also the Project CalWell that promotes mental health awareness and wellness among California's K-12 students. And that is provided for selected schools. But I want to mention that all of the resources associated with those efforts can be found on our web pages, and there's a tremendous amount of resources available regarding improving school climate, preventing violence, reducing mental health stigma and raising sort of levels of awareness and improving school climate. Next slide. And also within the unit, we have the comprehensive sexual health part of our unit, the California Healthy Youth Act, which has been around for several years and is required in that schools follow it. And new this year, maybe not quite brand new because we used to do it, but we're returning to monitoring schools, that they're using appropriate materials, and this is going to be done through the FPM process. We call it federal program monitoring, although this is a state program, but nonetheless it will be monitored both through desk audits and in-person monitoring. And then also we have HIV/AIDS instruction, which of course is still required in schools. And then we have new work being done this year on the LGBTQ+ statewide task force, which is gathering information and providing a report to the legislature this year that will look at how to improve outcomes among a very vulnerable population at times in schools, and that is our LGBTQ+ community. And also we have the relevant inclusive support that matters. This is very new, this PRISM training, which is for lesbian, gay, bisexual, transgender, and queer plus students. It's designed to improve actually their outcomes. The training itself is required now, effective this year, of all staff members. So there has been modules created that will increase staff member sensitivity and knowledge about the LGBTQ students who are in their schools, and that again is mandated and effective this year, required. Thank you. And next slide. And then please, our resources for any questions, our email is the SHSO, that is the School Health and Safety Office, at cde.ca.gov, and our staff will answer any questions that you have about any of those programs. Thank you.
Thank you so much, Dr. Herman. I have the pleasure of working with Dr. Herman and his team side by side on many initiatives, and they do an incredible job of providing resources and technical assistance to our school communities, including the checks, which is a great way to get a pulse on your school community, and excited to continue the work. I would personally make sure that you go ahead and reach out to them as needed. They are constantly updating their web pages, because I see them doing it, to make sure they have the current information out there and around the whole child as far as school safety. We know that that's a topic of interest for our school communities and our families, and they're an incredible resource. So thank you very much, Dr. Herman, for presenting. And I'm going to transition to my next sister office. I'm not sure if I'm supposed to say sister or brother. I'm not sure, so I apologize if I'm saying it wrong. But I have the pleasure of introducing Sarah Palanch. She is our administrator for the Tobacco Use Prevention Education Office in the Whole Child Division at the California Department of Education. She directs a youth tobacco prevention program statewide that provides leadership, technical assistance, and funding to public schools and youth-serving organizations throughout California. Sarah, would you come join me over here? I don't know, is it over up here?
Thank you so much, Carrie. Hello, everyone. What a pleasure it is to be here with you. And yes, I am one of the administrators in the Whole Child Division, so I work very closely with Carrie and Tom and their teams. And again, pleasure to be here with you today as we talk about how TUPE supports overall health and well-being. Next slide, please. First things first, this is our team. TUPE has been around for decades, but we came to be in an office in 2018, and we've been together ever since, all of us working for you. Next slide, please. So in terms of an agenda, just to give a quick outline for today's presentation, I will give you a very brief background on TUPE, talk about the importance of cross collaboration and how we do it, resources and technical assistance and what's available to you, the importance of our evidence-based programming, and then supports again for you for the school year. Next slide, please. So TUPE, starting with kind of the basics, right? Vision and mission. Our mission is to prevent and reduce tobacco and vaping among school-aged youth, but we are so much more than a don't smoke program, so much more than that. And I'd like to tell you a little bit more about that. Next slide, please. These activities, this is how we get things done. We rely very heavily on youth development, our evidence-based instruction, importance of peer-to-peers, which is a great example of positive youth development. In terms of policies, our tobacco-free policies are critical. It creates a norm around being a non-tobacco, non-vaping campus. Examples of family engagement and how we reach out to our community partners. And then, of course, with tobacco-related disparities, all the work that we do uses a health equity lens. And then last one I just want to highlight is the alternatives to suspension. While youth development and the evidence-based instruction relies a lot on prevention, alternatives to suspension, we're at the ready to provide interventions and lots of free resources available to you. Next slide, please. So why do we do this? Well, vaping is still a problem. When you look at this data from 2024, California Youth Tobacco Survey, with the sample of the 10th and 12th graders, we're looking on the far right, current use is past 30 days, 6.5%. So of vapes, that's tens of thousands of kids vaping. And then when you look at every use, that's hundreds of thousands of our students vaping. And we have really, we have a lot of concerns around that, and I'll tell you more about that. Next slide, please. So the youth vaping related health concerns are these, and let me preface this slide by telling you a little bit about the picture. So rather than grabbing an image from Google, this is a picture from a collaborative that we did with the Centers for Disease Control. We did a study, well, you might recall, many of you, in 2015, 17, the advent of the e-cigarettes and a lot of students being found on school campuses with these products. This is a picture from California schools, just as an example. So that's why you'll see a lot of the Juuls and the Sorens. We know that the products may look a little bit different now, but it's the same problem. We're very worried about brain development. Nicotine is a highly addictive drug and it's harmful to the developing brain. We know that it's a gateway to becoming a long-term smokers. You might recall that industry originally said, oh, well, vaping helps you get off of tobacco. That we don't find the data to substantiate that. And of course, we're still dealing with these are minors, these are children who are using these products who are not permitted to have these products in the first place, of course. Toxicity, we're very concerned about toxicity. A lot of these students will report that they use and mix their own e-juice and THC. You can put those products in. And we know that there's been an increase of visits to ERs. And we're, again, very concerned about that. Disease, yeah, lung disease, how it taxes the cardiovascular system, asthma, just not good for our youth. And then finally, and not at all least, is the impact on learning and mental health. Students will report less concentration, lowered mood, problems with memory, it can have a very negative impact on our students' learning. Next slide, please. So collaborators, we couldn't do this without you. And here are just some. Of course, we rely on our sister agencies, CDPH, who has the California Tobacco Prevention Program, and then the Tobacco-Related Disease Research Program housed at UC Office of the President. They're the public health and the research scientists, respectively. And we all do it together. And then along with education, all working together, trying to come up with programming that is effective and can be replicated. So here are some of the great partners that we work with. Friday Night Live, you know, absolute experts in positive youth development, how to work with youth. California School-Based Health Alliance, you know, where they actually have school centers on school campuses, so we can train up the healthcare providers to learn about doing intervention and cessation after, you know, of course, always starting with prevention and education about avoidance of all these tobacco products. What I'd like to also highlight is YVape. That is the free alternative to suspension program that we're very happy to support. Services are free, offered in English, Spanish. It's a really big deal. And our colleagues at UC San Diego house the YVape program. And then just to round things up, in the center of your screen, the TUPE Capacity Building Project, I'd like to tell you a little bit more about them. Next slide, please. The Capacity Building Project, they are our technical assistance and kind of training arm. Their goal is to build the capacity of all of our locally TUPE funded programs. And they really use this really wonderful collaborative approach, highlighting the model practices and best practices, constantly sharing resources out, and they are available to you. And here's some contact information. And I'll touch base on a little bit more about them just to kind of round out what I've said just now on the slide. Next slide, please. So our model, what we use is a whole school, whole community, whole child model. And I'm sure I have some fans here in the call. This model is definitely student-centric and really relies very heavily on school communities and understands the connection between health and academic achievement, and calls out the importance of the evidence-based school policies and practices. Of course, with health education, you'll see that kind of at the top of this little pie chart. No, that's not a pie chart. This circular graph is health education. So we do a lot of health education, of course, in our public schools here in California. And we concentrate a lot of our programming in that area. Next slide, please. So the evidence-based programming is, as I've mentioned, you know, curriculum, the prevention and education. We have some outstanding partners. Catch My Breath, Stanford Tobacco Prevention Toolkit are some. Intervention, you know, the YVape program. There are other programs that are text app options. We provide funding to schools to help students maybe interact with somebody in person. And then cessation, there's the Kick It California, who offers an outstanding number of services, all intended to help our kids quit. Next slide, please. So just one example I wanted to call out, just a tailored example of and trying to braid mental health with vaping and tobacco, and how vaping can exacerbate mental health symptoms, anxiety and depression. And then there are reports that it can improve their condition once they quit. So there's this really positive social media campaign that was done. You'll notice that it leads with positive messages. I feel less tired. I'm happier. feel less depressed, and then finishes, mental health improves when you quit vaping, or depression symptoms improve when you quit vaping. You know, these were they're always focus tested. These are free messages available to you. And I just thought this was a nice example of some of the work that we're doing, and to share it with you around braiding mental health and tobacco and vaping prevention. Next slide, please. So coming soon, it is not quite live, but we are getting there. We're still testing it. But there's this really nice opportunity that we have to share this family outreach campaign, which is essentially a digital format whereby we provide information about the dangers of teen vaping, and it's targeted towards parents and caregivers. So, you know, it's explaining what these products are, how to talk to your student or your child. Another thing that we're really excited about is this is going to be translated into threshold languages that are meaningful to you and your locale. So this is very important. Of course, our 2P coordinators, we have a county coordinator in all of our counties across California. They'll be informed of this, and we'll roll this out coming soon. And then, of course, we'll share this information with this group once it goes live. We hope in the next couple of months. Next slide, please. So just to start wrapping up my presentation, some of the highlighted resources. I mentioned the Alternatives to Suspension Toolkit. Capacity Building Project did such a great job in creating this toolkit. If you go to the website, 2pca.org, you'll be able to check it out. You'll see some of the other fact sheets that are available that are quite relevant. Nicotine pouches, or ZYNs, are gaining more popularity. Tobacco-free school policies, why we talk about them all the time, why they matter. So just an example of some of the resources that we have available to you. Next slide, please. And then back to school resources continued. Here are our websites. 2P resources, again, 2pca.org. We have GEMS, which is the Grant Electronic Management System. They have all sorts of free resources available to you. And then finally, our office at the California Department of Education, 2P office. These are all hyperlinked for you, so you can keep in touch with us or get these resources to you. Next slide, please. And then finally, a big thank you. Here's our contact information. Here's our email. Drop us a line. We'd love to hear from you. How can we improve our collective impact? What do you care about? Can we incorporate youth tobacco more in your community? We are all ears, and we'd love to hear from you. Wishing you all a very successful and healthy school year. And of course, to all the students that you serve. Thank you for your time today.
Thank you so much, Sarah. And truly, get in touch with 2P and Sarah. Our office is right next to theirs, and they are an amazing group of people. So please do get in touch with them. She really means that. Next, I'd like to introduce Bob McCullough. Bob is a distinguished mental health professional with over 30 years of experience supporting individuals through inpatient, outpatient, employee assistant programs, crisis intervention, and school-based services. He holds a PhD, MSW, and is licensed clinical social worker in 4 U.S. states. Currently an adjunct professor at Missouri Baptist University, Bob's recent work focuses on leveraging digital solutions to proactively address mental health needs. He regularly consults with local, state, and federal leaders and remains dedicated as a clinician, educator, advocate, and strategist to improving mental health and well-being for future generations. Welcome, Bob.
Thanks, Pam, and thanks to everybody who's stayed around. We've talked about a lot of things over these last 2 hours, and I think it just goes to show the great resources that are out there to really support the youth and families across California, and that it really does take an ecosystem like this to be able to support those needs and services that our youth have. So what I want to spend just a few quick moments about is really talking about Hazel Health, which provides physical and mental telehealth services. So in an attempt to really provide additional support within that ecosystem, we are a telehealth organization that can provide many of those needs that have already been talked about. So on the next slide, I wanted to be able to just give a little bit about how we operate. And it really is as a virtual clinic, so that within any of the school districts that we currently operate, and there's 109 across California that we support, it really gives an opportunity for the youth and family to have easy access to licensed therapists and pediatric clinicians. This really does give us the opportunity to be able to reduce lost learning hours, which we know is so vitally important, but also for our family members, as they are involved in supporting. So many of the families that we work with are hourly employees. And so by reducing the amount of lost work hours as well, it reduces that financial burden, which we know is a huge barrier for many in accessing healthcare. On the next slide, if you would, there was a really cool graphic that was supposed to show up on this slide that I apologize is not here. But it also talks about care coordination. We know that telehealth is not the magic solution for all things. It really does involve that ecosystem. And so in care coordination, it gives our team that opportunity that if there is a different level or a higher level of care that's needed, our team will work directly with the youth and the family to make sure that they're gaining access to those services at the right time and in the right place. Think of it as that peer-to-peer type of referral to really help cut through that red tape and speed those services up. On the next slide, please. So just a little bit about some of the common concerns that we see. And again, I'm sure you're very familiar with many of these. So what I want to highlight on this is that we do provide our services both at school and at home. We've extended our hours well into the evening and on weekends because there are those needs that happen outside of the school day. And so while oftentimes there may be a kind of a virtual clinic need that can happen in the school, such as a presenting of a cough or a slight injury. There's also going to be things that happen at home that just gives parents that opportunity to have access to other needs and services. Next slide, please. So quick look at how a pediatric healthcare visit might occur. Again, shows up in the nurse's office. We would go ahead and make sure that we have consent. We could bring in one of our providers through the technology that we provide into the schools. So in a few minutes, that student is on a Zoom call with one of our pediatricians, as well as bringing the parent or guardian into that call. And if the child needs to be referred somewhere else, we can certainly provide that referral. The other thing that gives us an opportunity is that we know that many of the mental health symptoms manifest themselves as physical symptoms. So we can do a quick assessment, and if it looks like there may be a potential mental health need, then we can make that appropriate referral as well. But you'll see that what we find is that about 8% of these physical health appointments occur at home, 92% at school. On the next slide, you'll see that that's a little bit opposite for the mental health appointments, because there is a difference between your presenting issue and then your assessed issue. And so oftentimes it's very important to make sure that the guardian and the parents are involved in those sessions, which is why more of those sessions tend to be at home during the evening and the weekends as well. On the next slide. Want to wrap up with just talking a little bit about some of the engagement. So this is not a telehealth service that we just introduce into the school and then we wish you well, and if you make those referrals, then we provide the service. We're very engaged. So our customer success teams are on the ground. They're in the schools. We're participating in workshops and in webinars and in health fairs. And all that really does drive our engagement, so that you'll see on the next slide, we'll see things like almost 37,000 visits over just the last year throughout California schools. And again, you've got some of those reasons for referral there. But as a clinician, I think one of the most interesting things is the age. Our average age of referral now is 11 or 12, and that fits with what we're seeing in that the majority of the services we're providing are for grades 5 through 7th. So the age of our students needing mental health services is getting younger and younger. And so it's the importance of being able to have these services to really bring in that ecosystem and tie it all together. One of the other things that we're heavily focused on right now is absenteeism. And so we have some work that we've done with some of the California school districts that really show how introducing a service like Hazel, when there's an identified absenteeism problem, can really help reduce those lost learning hours. And on the next slide, you'll see just an example of, again, how we're engaged with bringing in clinical support to any councils or committees that you may have that are bringing awareness to mental health issues. And on the next slide, we'll talk about our student ambassador program. So this is just an example of the program that we began at LAUSD, where groups of students can come together as ambassadors, talk about that healthcare, and we actually award a number of scholarships each year to students that are looking to pursue post-secondary education in a health-related field. And then on the last slide, this is just how you can contact us if you have any additional questions or would like to be able to discuss how Hazel can help your school. And Pam, with that, I hope that I met the timeline, and I will turn it back over to you.
Thank you so much, and thank you for sharing information about Hazel Health as a resource for our school communities in California. I will ask Pam to drop the contact information in the chat for everyone. And I want to thank all of the panelists that are here with us today. I want to also thank everyone that attended, and I really appreciate your time. So we will be sending out a post-webinar survey to receive feedback, because we always want to know what is working, what is not working, and what we can do better, and understanding that the Californians are diverse and the needs differ depending on the community for which you reside. So look for that survey and let us know and give us the feedback we need to make the decisions. As our time ends here today, please take a moment to drop in the chat, Richard and Michael, if you could please open up the chat, one word that describes your experience here today. I want to take the moment to thank each one of the presenters that were here today. Your time, your expertise, and willingness to support this work is a gift to the students in California, and we are very grateful. To the participants here today, thank you for being present, engaging, and learning with all of us throughout the process. You are not doing this work alone, and we will be here to provide space, support, resource, and guidance throughout implementation. I hope you all have a wonderful back to school year 2025-2026. Thank you all very much. Oh, one last plug is that we will be, Dr. Boyer is leading the work on creating a stellar webinar around suicide prevention, intervention, and postvention in September. We'll drop information about it. Some of the content experts that she has found, both locally through the state and nationally, it is going to be an incredible experience for all of us. We want to share that with you. And I'm going to leave you with that quote that we say in the Office of School-Based Health Programs that we have married and love, is that, remember, every child is one caring adult away from changing their narrative. Please be that one caring adult. Take care. Bye-bye. All done. Nice. That was a good one. It always is a good one. That one and the suicide too.